So let's transition now to treatment. So does treatment depend on how severe symptoms are in a patient? How does treatment work?
Yes, definitely treatment depends how severe the patients are. And for those patients who have, a grade 2 or prolapse, usually with pelvic floor therapy and exercises, you will improve significant that therapy without having to have any type of, surgical treatment.
So looking at the graphic, what is mechanical treatment?
Mechanical treatment are more associated with pessaries or other devices that are placed in the vagina in order to support those pelvic organs. There is now people who are claiming that radiofrequency therapy could be associated with improvement of the pelvic organs, but their studies do not support this at this time. And you could see there those pessaries, they've been around for many, many years. Depending on what type of prolapse you will use a pessary. The difficulty with pessary is that they have to be cleaned every 3 or 4 months.
Right.
So you have to go to the physicians to clean them. Some patients are able to remove themselves and clean them, but especially at older populations. Now, pessary, you can see those devices that are made of plastic, and sometimes they erode into the vaginal wall, so they have to be cleaned properly, and you have to maintain good hydration of the vaginal wall.
There's a maintenance to them as well.
There is a maintenance to pessaries, but they're great. They're great, and they work very well, especially for patients who are not good candidates for surgical therapy.
So we did mention the behavioral treatment earlier, and it's interesting because 25% of women who actually do the Kegel exercises don't do them right. Is this correct?
That is correct. I think that a lot of times what happens is most patients do not understand exactly how to contract your pelvic organs. So that's why when you have pelvic floor therapy, in which you have someone that's trained and understands and devices that allow you to see exactly how you're contracting those muscles, once you're able to do that, then you could do those exercises on your own and you do very well afterwards. But I think it's important that you know exactly how to contract those muscles.